Hey guys, welcome back to Nurses.co.uk. My name is Claire and I'm a second year adult nursing student from the University of Southampton, and today I'm going to talk to you about to know if nursing is the career for you. I know a lot of people who watch this channel are currently doing nursing, but I'm also aware that some of you might not be currently enrolled in a nursing degree in UK or otherwise, so maybe this video will give you some inspiration if you think you're considering nursing but you're not too sure, or also if you're currently enrolled in nursing but you're not too sure if it actually is the course for you and you're hemming and hawing about if you should drop out or stay in the course. So maybe this video will help you decide if nursing is the career for you, so stay tuned to find out more. The first thing I think is really important when you're considering if nursing is the career for you is to decide if you really enjoy helping people, and if you can imagine yourself helping people day in, day out without being like drained from it. I also think it's important to be quite an extroverted, friendly person as well when you're doing nursing, because your whole day will be spent around people and your whole career will be involved around helping people and making sure that you can make somebody's hospital stay the most comfortable it can be. So I think if that is your passion and you know it's your passion, then that's amazing. But if you're not too sure if that actually is your passion, then I would recommend trying to get some work experience to find out if that actually is your passion. So maybe go into a hospice for a week or two, or maybe being a healthcare assistant as a part-time job. And if helping people and being around people all day gives you joy and you know it's your passion, then I definitely think nursing is for you. And then if not, maybe think about nursing maybe a bit longer before going in. I would just say one thing: going into nursing I don't think should be taken lightly. I think it's quite a difficult course and I think some people definitely struggle with the course. So I think 100% knowing that going in that you really like it makes a big difference. Of course there is going to be days where I don't like it, or my friend doesn't like it, or even the best nurse in the world doesn't like it, because there's going to be tough days. But overall, as long as you know that you're passionate and really enjoy what you're doing, then I think it's definitely all worth it. Number 2 might seem like a funny one, but I think if you have a really big interest in shows like A&E and the hospital, like the real life kind of gruesome hospital like documentaries almost, then maybe that's something you should explore further. Because I know growing up I was obsessed with 24 Hours in A&E. I think there's been like 17 seasons and I've watched them all. So I think that just shows like that is my passion. And people laugh at me because I get home from a 12-hour shift and then I sit in bed and watch 24 Hours in A&E. And that might be a bit extreme and a bit excessive and maybe a bit too obsessed. But I think if you find that really interesting and you can actually imagine yourself doing it and not just, oh, that's interesting, but I could never do that. If you can actually picture yourself as that nurse in A&E running around doing everything, then maybe that's something you should explore further as well. I would, just like I mentioned, I would recommend trying to get some type of work experience. And people often ask me that it's difficult to, and not many places want to accept them and stuff. But I think if you're an aspiring nurse and the NHS is crying out for more nurses, then I think most places would want to take you for some work experience. In Dublin I had a 2-week work experience in my pre-nursing course, and that was in a private hospital and I loved it. And they were more than happy to have me there. Of course, because I was a pre-nursing student, I hadn't even got into nursing school at this point, and they were kind of like hesitant to let me do things, and obviously for insurance reasons I wasn't really allowed to do much, but I still was allowed to observe. And I think even observing and doing little tasks like running to get something for the nurse, I think will make you realise that if it's what you want to do, you'll actually really enjoy running around and being the second pair of hands, because you'll be so engrossed in what's going on and so interested. And even just sitting down and talking to patients, you don't have to have insurance for that, and you don't have to be an actual student nurse for that. And just talking to actual patients while they're in a hospital setting or a nursing home setting or a hospice setting while they're unwell, I think will give you an understanding of what nursing will be like. And if you enjoyed that, then maybe you'll enjoy, you know, the whole process of becoming a nurse. Obviously, a big part of nursing as well is the theoretical part, so the part we actually learn about in university, which includes like anatomy and physiology, acute care needs, long-term conditions. And obviously this is quite anatomy based, and it's quite factual, and sometimes it's difficult to learn. But I feel like if you have an interest in anatomy and physiology and biology in school and want to learn more about the human body and how it works and how it digests things and how different drugs react with the body, then I think that's a really good place to start. And even if you're sitting here watching this video right now and you are thinking, but I can't get work experience, I can't do this, I can't do that, maybe just start reading a bit more about biology and the human body and things like that. And then if you find that interesting, then you can go from there and maybe explore further into nursing about what it entails, and maybe look at ICU nursing and A&E nursing and just get the whole kind of vibe of what nursing actually is like. I think another aspect of nursing that's super important is the selfless aspect of nursing, and also the non-judgmental aspect. Every human judges people. We all say, you know, let's not judge, let's not try to. But I think at the end of the day, everyone does judge, but it's how you act on your judgment. So I think especially with nursing, you might see something and be like, what? You know, thinking things in your head, but I think it's how you act on that judgment and how you talk to that patient without bringing in what you've seen or bringing in things you know about their relationships or their family life or anything like that. Being as completely non-biased as humanly possible, and just being as non-judgmental as you can. And if you can do that in your everyday life, when you're with friends and family, then hopefully you can carry that trait through to your nursing career if that's what you want to do. Because I think judging other people is something we all do, but I think just how we act on that, and maybe not making it as like harsh, and understanding that everyone's different, everyone has had a different life experience, and trying to understand where that person is coming from, I think will make a huge difference in your nursing career, and will just make it so much easier to be able to go into nursing and not be this judgmental nurse that nobody wants to be. If you have those traits naturally and you're willing to work on them and become less judgmental, I think that is something that every nursing school in the whole of the UK will want as a trait in their future nurses. So I hope these kind of 5 points that I've given you today will help you decide if nursing is the career for you. And if you're currently in university, I hope that it's going well for you, and I hope maybe this video helped you reiterate the point that you are meant to be doing nursing and that you're in the right place. So thank you so much for watching this video, and of course don't forget to like and subscribe to Nurses.co.uk for more videos just like this one. Bye!